It's really not just about HIV, because no kid cares so much about HIV that they want to stay and continue talking to you about it after the program. What's the most valuable thing is the relationship that's built between the student athletes and the kids.
HIV/AIDS makes no distinction and knows no borders. The message I gave to the people of Kenya 3 years ago rings just as true for us here in the United States today.
I think the biggest thing that I've learned is how much education can work with social justice and how they can really work hand in hand, and the influence that college students and student athletes especially can have on middle schoolers and kids at that age between 12 and 14 years old, and really just how important it is and how integral education is to social justice. And it's not, we're not going in and curing HIV or AIDS, but we're going in and we're doing preventative measures through education. And I think that's really, really awesome and really cool, and you don't really think that, especially something in the field of like public health or like social justice, can be solved just through like preventative education and the way that we work and the way that we teach, and through games too. Like who would have thought that like through a bunch of games we can teach kids about a really serious problem in Washington D.C. In the health field. So I think that's the coolest thing that I've learned, of just how influential and powerful education is.
We've worked with students from grade 5 and 4 all the way up to seniors in high school since we started in various different projects. But from the data that we've seen, we measured the impact of all the programs that we do, and the data shows us that our program has the biggest impact on 7th grade students, 6th, 7th, and 8th grade students, but mostly 7th grade students. So that's why we choose to focus on them. I mean, I think also intuitively, just outside of the numbers, middle school is a time where kids are still trying to sort of figure out who they are, and peer pressure isn't quite as great in middle school as it is when they get to high school and they become like a little bit more independent. So for us, it's all about equipping kids with this knowledge and this support and this critical dialogue around these issues before they get exposed to these risks, and before they become more independent, and before they have tons of pressure from different cliques and friends and things like this in high school to make various decisions. The way our model works is we recruit student athletes from these universities, and we train them over the course of 2 weekends at the beginning of the semester. And then they are put into groups of 5, and they go out into middle schools 1 day a week for 8 weeks. So for a student in our program, it actually works out really well, because we actually run our programs during the school day. So essentially these college athletes come in during their PE or health class, and they just teach our curriculum within that actual period. Each of the games in the curriculum is really interactive. Most of them are quite competitive, and the kind of pedagogy or the theory behind the curriculum is that students are much more likely to learn and remember messages if they're participating in the process of learning, and if instead of us teaching them and telling them the different learning objectives in the curriculum, if they're telling us what those learning objectives are by describing the game that they played.
This is incredibly corny, but in so many ways it's been life-changing for me. I started Grassroots my freshman year and my freshman fall. I came into GW, I didn't know what I wanted to do. I was pre-med, but that was about it. I didn't have a major. And started working in the schools, and I realized this is something that I want. I don't want to just help people on an individual medicine level. I want to help populations, because I went into schools and I saw that these kids were at a disadvantage from the second they wake up in the morning. They didn't have the parenting that I had. They didn't have the school, the education that I had. They didn't have a lot of the things that I was able to have growing up. And that was a realization I had, first week going into a school. And I realized that's what I want to do with my life. So now I'm a public health student. I'm in a master's program at GW to get my MPH, and my concentration is in global health. But like to go abroad working with HIV and working with other programs. But I've kind of formed my academic career with Grassroots, and it's been an awesome opportunity to also get really involved in the nonprofit. So I've seen the management change from not having a big office and not having full-time staff to having 3 full-time staff and really running effective programs, which has been really cool to kind of see the transition over the 4 years. And I've learned a lot about how nonprofits work from that. One of the biggest things that you guys have the opportunity to do is spread the word and spread the knowledge.
Honestly, just spreading knowledge about that and just sharing that with your friends, your family, anyone else, you know.
And you understand the statistic. You get how crazy and scary that is. There are adults, there are kids, there are every single age, every demographic. We have people that don't understand what the disease is, how it spreads, you know, what are the social factors that lead to it. So things like poverty and access to healthcare and education level and all these different factors.
Getting tested, you know, making sure that people know that getting tested is okay and you can get tested and it's like free to get tested. And, you know, you don't, it's not something that you should be ashamed of. You know, like, you know, go ahead and get tested, know your status, and just share that, break down that stigma on HIV.
I didn't know that at 16. And if you guys can make people in your high school know it, you guys have the ability to start something at a young age. And it, you know, everything we talk about is at this grassroots level, is this level of like we're directly intersecting with the community. You guys live in DC, I'm assuming.
Yeah.
So like, you know, this is your community and taking pride in that. Like, there's some really awesome aspects of DC. Let's not let that be clouded by this awful epidemic that we're kind of afraid of talking about.
I think there's a lot of hope for DC because I think DC is realizing in the last 5 or so years how important it is to reach young people with, you know, accurate information and to sort of force this awkward dialogue with students.